Okay, hello everyone. Thank you for joining us on this special day and time for a webinar. First, I want to thank Cindy from Alternative Communication Services for her persistence in getting connected today so that we all have captions. If you haven't done so already, you can hit Control F8 on your keyboard or the CC button at the top of the video screen for captions. We're joined today by Diane Nens, who is an audiologist with HealthInnovations in the Detroit area, where she serves as an audiologist and an advocate for hearing health care for people with hearing loss. Because we're starting a little bit late, I just want to thank everybody again for joining us, and I'll give Diane the floor. Thank you so much, Diane, for presenting today.
Absolutely, and thank you, Nancy. I'm thrilled to present today. I'm very excited to have the opportunity to talk about our company, HealthInnovations, give an overview and discuss our delivery model and our products. And I have to say what an exciting time it is in our industry. It's ever evolving and changing, so it is quite a time to be having this conversation. And I would also like to thank each of you for attending the webinar, and I truly hope today's information gives clarity to the full spectrum of high health innovation and the services and products that we offer. So with that, I will go ahead and advance the slide. I just thought it might be interesting just to take a brief walk down history lane, memory lane, and came across some some cute advertisements. That first one there from 1910. It was for a 30-day trial period for Dentaphone, and I will read just one of the statements on there as written. It says, full refund if the instrument does not do all claimed for and proven in every respect just as represented. So I think we'll touch a little bit later on that with expectations. Moving on, back in the 1940s, as we can see that advertisement, they were talking about lowering cost of hearing aids, even then. We had mail-order hearing aids as early as the 1970s, and then of course we move up to 2011 with HealthInnovations. And you can see some other statistics on there, and with us a little short on time, I'll just go ahead and advance to the next slide. So who is HealthInnovations? Everyone knows the name, but I want to give more detail and clarity to this. So we are a United Health Group business launched in 2011 to serve the needs of millions of Americans with hearing loss. Our mission is to improve access and affordability of hearing health care. Our goal is to identify and treat hearing loss earlier for better overall quality of life. And addressing the cost and affordability factor here first, HealthInnovations is addressing and has been addressing a need. As we know, there are probably approximately less than 20% of people with hearing loss that actually use hearing aids, largely due to cost. So given the needs of the increase of hearing loss, it is a serious health issue. The numbers are on the rise. HealthInnovations delivers hearing aids low cost to consumers. Many times, and I know probably many of you are aware of this, that there's limited insurance to no insurance coverage. And then the consumer has to shoulder the financial responsibility completely. So it can be very expensive, as we all know. So cost is a big factor. In addition to that, taking that cost one step further, most times hearing aids are not a one-time purchase. So throughout the years, people will be replacing hearing aids and incurring the cost time and time again. And for some folks, it can be unaffordable. So we really are focusing on that, bringing down that barrier. Also, with that said, moving on to education, we are passionate in providing education for awareness on hearing loss, treatment, and offering resources. And we do this through many mediums. We've done radio, TV, and newspaper. Our United Health Group PR media outreach has just been fantastic. We've been able to reach millions of people nationwide to raise awareness and provide education, like I said, through TV, radio, and print. And in June of last year, or this year, I'm sorry, June of this year, the Hearing Loss Association of America and HealthInnovations did work together on a public service announcement, and it was on the initiative Protect Your Hearing. And the goal of this initiative was to raise awareness of the increase of hearing loss and the importance of the hearing loss prevention, protection, and treatment. Touched many, many lives with that. You know, we have hearing health seminars. We have field staff professionals employed by HealthInnovations all across the country in specific local markets. So they personally can reach out. They can organize hearing health seminars on many related topics. We also can do this through our corporate structure, and that would be through a nationwide daily telephonic seminar. It's led by an audiologist. And with that, we really are launching, our goal here is to facilitate a positive message, to empower people, providing the education options and resources through that. In addition to that, I really think it's nice because we allow enough time for people to ask questions so that we can really personalize the seminar to each individual. You know, our website, we have been making updates very, very recent to now, so things could be changing since I have designed this webinar. But you know, we have support through our website. So we have a section there. We have FAQs, communication tips. You know, we have expert advice and tips. So other than products, we have media information. So we always encourage our patients when we're seeing them in person, as well as our customer service team when talking to consumers on the phone. We always encourage, if they have internet available, to definitely go on and research the internet or our website. Moving forward, so we talked about cost. So how do we do it? How are we bringing down the cost? And I get asked that question a lot. And just to give you a little background here, I see patients in Michigan. I'm in the Metro Detroit area, so I do see patients for HealthInnovations. I also work on other aspects of the company with marketing and outreach. So I'm asked this question many, many times. And we are part of the United Health Group, and we leverage that large scale and purchasing power. So we are able then to bring the cost of the hearing aids down and transfer that to the consumer. With that being said, you know, I also am asked many, many times, well, do you only see United Healthcare members? And we don't. We see all consumers. We work with everyone, regardless of insurance. So again, offering low-cost options. However, those individuals that do have United Healthcare insurance, those members do receive even greater discounts. This is an important part of the presentation for me, because I am under the impression that a lot of times people think that HealthInnovations is only a mail order company, and we're not. We have several convenient access options. So for a person that would like to schedule an appointment, and I call this the more traditional route, they would like to have an appointment with an audiologist or a licensed hearing aid professional in person. They call our toll-free number and they ask, if there is a High Health Innovations professional in their area, or you can find that information as well on our website. And if so, they will go ahead and make an appointment. The services offered are free hearing tests, hearing aid fittings, verification and testing, ear mold impressions and fittings, and follow-up care. So I call that the more traditional route. Then we have an option for others, if they choose not to go that way, where they can receive hearing aids by ordering on the phone, online, or even faxing information in. And what they do is they will send their hearing test. It has to be within 1 year, and a licensed professional reviews every order, every hearing test that comes through. With that, if there is a concern with the hearing test, for example, if there's asymmetry or any of the FDA red flags, we will reach out to them many times as the professional themselves, or it can be our customer service team, and we will reach out, we will counsel them, ask questions, really make sure they understand why we are questioning this, what we're looking for, and that it's in their best interest to follow the recommendations. But hearing aids are not dispensed until medical clearance is given. The consumer then will receive the custom programmed hearing aids by mail. They come U.S. priority mail, and they go directly to the customer. Support is very important to us. That's key. And we have an excellent support system in place, and we try again to have as much support in as many different ways as we can. So first and foremost, we have the daily telephonic hearing health seminars that I previously mentioned. So the customer can call in, and it is live. They just put a passcode in, and they are connected right away. It's a great opportunity for not only learning, but learning also takes place through talking to their peers. I know when I've hosted it, I've really enjoyed connecting others and letting other patients help patients. We share communication tips and so forth. We also have an audiologist on call, and that's every day, Monday through Friday. And that takes place when a customer may call. I call it our lifeline phone number. That's our toll-free number. And they call that for anything. If they need an appointment, if they're having an issue or a question, they call that number. If it gets to be a higher level problem that is not easy to troubleshoot for our customer service team, that's when they reach out to the audiologist on call, and then we go ahead and take that case and call the customer and help them. We also have the website, as I mentioned earlier. We have helpful videos. We call them how-to videos. Our user guides are on there. We have communication strategies and hearing health information. So we always direct people to the website as well. And as previously mentioned, we have the in-person support. Those people that want the more traditional model, or they feel like they might just need a little bit more time and attention in person, we have that in many cities. In addition, talking about in-person support, we have providers that are not employed by High Health Innovations, but will also work with our patients. Many of the providers are, providers that will say, I just want to do ear molds. I'll do ear mold impressions. Or others actually have our software, and they do program adjustments and follow up to our customers. This is more of an unbundled pricing model. The consumer pays for the provider services separately from the price of the hearing aid, giving the patient more options as well. So, and I can answer questions at the end more about the specifics of our program, but we really are trying to provide as much as we can on as many different levels, from education to products to support to the best customer care, patient care we can. Our customer service team also calls patients 2 weeks after they receive their hearing aids, checking in on them to determine how they're doing and if there's any areas where we can be of assistance. And moving on, with any industry, there's always challenges. And this is just industry-wide, it's not High Health Innovations, but I wanted us all to stop and think before I move into the products. What are the challenges with hearing loss? We know it's a complex disability. It's very complicated, and it's not one size fits all. So some of the, just a high level here, some challenges are, number one, those individuals that need hearing aids typically wait too long, and we know there's lots of reasons for that. We have acceptance, and I always say that, there we go, if people do not accept the fact that they have hearing loss, then it's very hard to help them. So, and it's likely many people come into our clinics that may acknowledge that they have a hearing problem, however, they're not ready to accept it. So we talk about things like that make it, rather difficult. We talk about expectations. Many times a patient will have an expectation that's just beyond what any hearing aid can achieve. So again, counseling is key. We are very big on counseling, both online, on telephone, as well as in person. We also want to really zone in on, is the patient a new user? We really get into finding out where that patient is, asking some questions so that we can better counsel them. We're still seeing the influences of, what is holding someone back? Why are they not pursuing hearing aids? And sometimes it's still, believe it or not, the stigma. We still have that, whether the stigma is something that they think, oh, it's an association with age. Maybe if I wear hearing aids, I'll feel older, or maybe they're worried that they're going to look older. It could be cosmetic reasons. Maybe they want to hide their disability, that they view that they need to hide a disability, and so forth. We have the perceived versus actual benefits, and this is big. That's tied to acceptance. And this could be a situation where a family member is possibly, pressured the patient to purchase. It could be tied to expectations. Say, a new user may expect that the hearing aid will solve all listening problems, or it could be cost. So, does the perceived benefit that they really think they're going to get match with their actual benefits? Again, I think counseling is very important here. Cost, we know that's a challenge, and we've addressed that. We have value, that benefit that's relative to the price of the hearing aids. So that's really important. And everyone comes from a different place with that. So that's something that's very difficult just to pinpoint early on, as well as the person's accessibility to hearing health care. We talk about our mission being to provide more accessibility. And sometimes there are issues. It can be transportation. It can be awareness to the accessibility. So we see all levels of that. So those are the challenges in an industry that we face. As I say that, we think about cost, we think about adoption rate, we think about the numbers of people with hearing loss today. And why aren't more people pursuing hearing aids? Well, we still have some basic challenges that we still have to address as an industry. But with High Health Innovations, the starting point with hearing healthcare. So we talk about this. This is hearing aids, and I'm going to get into our specific hearing aids in just a moment. But audibility is the key. Well, that sounds really, really easy. Wouldn't we all think that audibility is the key? Well, it's not as easy as it sounds. It is the single most important feature of a hearing aid. We want to hear better. The sound should not only be audible, but useful. And the sound that is provided, it has to be very specific to that area that's needed, but it has to be considered aidable and enhance word understanding. When we talk about that, just some of the complexities to give you just a deeper understanding is that, amplified sound needs to be placed in a restricted or narrow area many times, and that's the area of hearing loss. We want to really concentrate on those speech frequencies. However, some people have very restricted areas, and it's called a restricted dynamic range, where loud parts of speech exceed their uncomfortable loudness level, while the consonants, those high-pitched consonants, and they are so important to give us understanding of speech, they fall below the hearing threshold. So it makes it very difficult for understanding speech, for that clarity. And then certain patients can experience distortion of an incoming sound, and that makes it more difficult as well to understand other sounds as well as speech. We talk about evidence-based features within the hearing aids, and I'm going to get into all of these. But talking about directional microphones, I'm sure you're all very educated and aware that directional microphones amplify sounds from the front more than the back, and there's 2 ports there for that. And that goal is to improve speech intelligibility. It's based on the environment and location, the signal we want, and that of the unwanted sound. Noise reduction. It's well known the background noise reduces intelligibility of speech, and the greater the level of background noise, the greater the reduction of intelligibility. And the hearing loss just adds an additional layer of difficulty that can result in inaudible speech or severely distorted. And we also know that we need the processing. Our brain is processing, and we need that. Everyone has a different ability to do it, but we do need that feature as well to help with understanding of speech. Adaptive Feedback Manager allows for greater amplification while reducing that problematic feedback. So the products, this is what they look like. We have the full range from the ITC, which is very small, and it takes a size 10 battery. We go next to the what we call the BTE, and that most times comes with the slim tube. We have the telecoil option, and then we graduate to the Power Plus for more severe hearing loss, and we fit that with a custom ear mold, and then the Power Max as well with a custom ear mold. And the Power Max takes a size 13 battery. All hearing aids are programmed according to the audiogram and NAL-NL2 prescriptive fitting formula. The behind-the-ear models have a volume control and 3 programs, and the ITC has 3 programs, just 3 programs. The way the hearing aids are programmed when, let's say, someone does mail order, they are received with Program 1 designed to meet their target. Program 2 is for noisy environments, and Program 3 is either the telecoil or an acoustic foam program. Okay, so I'll go back and talk a little bit more, give you more details. So with the, what is included with the products? We use the unbundled model. So we have, there's no charge for the hearing test if seen from one of our providers. There's a 70-day trial period. All of the money is refunded should the patient return the hearing aid, except for shipping costs. They receive a 6-month supply of batteries and spare set of thin tubes. There's a 1-year manufacturer warranty, but the hearing aids do not have a loss and damage warranty on that. Follow-up appointments during the trial period and annual checks, hearing aid adjustments, whether that's in service, or in person or through customer service, and access to a user seminar and all of the support that we have in place. So, moving on. Audibility is important. We're talking about our delivery and our support that we have. And through Audibility, the delivery channels, the various models, and the support in place, we truly believe that we will have success. And we have many, many people that do report back to us. We've received thousands of response comment cards, and we also, as I said earlier, we have a customer service team that reaches out, and we really do hear great, great success stories, and we really have changed a lot of lives, and there's a lot of impact there. It makes us feel good on a daily basis how we are changing lives. I never realized the amount of hearing loss that truly was untreated, largely due to cost, until I began working at HealthInnovations. I'm going to move on. So quality of life. Kochkin in the Hearing Review has an article and does talk about direct mail hearing aids providing the consumer with high value compared to traditional fittings, and that's especially for those consumers who have their hearing aids fitted in settings utilizing below average best practices. However, quality of life was improved regardless of how hearing aids were purchased. And the key factor, again, as mentioned earlier, is that improved audibility. And going beyond hearing aids, just wanting to touch on that just a little bit here. We also support, we recommend assistive listening devices. We recognize that there are situations where, it is best to have something to augment the hearing aid. So we recommend support groups, we recommend ALDs. We really do try and provide as much information as we can. And when talking about support groups, such as HLAA, we'll recommend reach out to HLAA, look for a local chapter. We give them the information. Our user seminar is considered not only educational, but at times it can be a support, and it is a group setting. And in person, in local markets, we do have those seminars and special groups that do take place. And those collaborative problem-solving approaches with the group programs really, really help the communication with partners. I think it really helps the family members, partners, significant others to understand and have a more realistic approach and appreciation of the hearing aid user's communication issues or struggles. I think that the hearing aid users themselves really realize that, I'm not alone here, and I have support. I didn't realize, I thought it was just me. So I think that on so many levels that the group support is so important, and again, we are trying to incorporate that as much as we can. And talking with families, just as their role, they can just be so very helpful in really making a difference in the success of their loved one wearing hearing aids. So I think that educating the family as well as the patient is just an important piece here. And again, talking about the messaging, we just really want to facilitate a positive message. We want to help them manage their hearing loss regardless of the format offered, whether it's individual counseling, reading materials, referrals to websites, or videos or support groups. We're very passionate about that. And what I would say to the group here is that, we know that with today, everything that's going on and the changes taking place in our industry, it's happening so fast it's kind of hard to keep up with. But that's a good thing, on many levels. So I would just ask all of you, help us raise awareness of alternative delivery models. Really looking at the pros and cons for individuals, and it may not be right for you, or it may be right for you. Everyone's situation is different, but just knowing what is out there. I know you're also proactive and advocates for people with hearing loss and resources. Just knowing what's out there, you can even help another person that may not be as aware. I think that nationwide, it's wonderful to have those resources. And for our program, a real positive is that we are nationwide. So we offer convenience with our access points, with our service, with our customer support. So when people move or travel, we are able to capture and help them, whether it be in person or through the corporate structure. One area I want to back up that I did not get to, I want to talk about, and then I'm going to open this up to questions. I know we're running just a little bit behind, so I'm trying to move along. I want to go back. The slide may have advanced on me. Talking again about our nationwide customer service. So we offer, as we said, in-person support as well. That's an option in select markets. Now, if a person calls in and chooses they don't want to go into an office, or there's not one nearby, they can also receive programming adjustments through mail order. So when I say that through the mail, what happens is the customer service team sends the consumer a shipping label, and that way there's tracking and insurance on their hearing aids. They send them in. The hearing aids are programmed within a day. They're at our corporate office 1 to 2 days and mailed directly back to the consumer. So we have that as well. So once they purchase hearing aids, it's not that they're out there by themselves, they're alone, and that they have no support or programming ability. We follow up, we provide services, and we take care of the hearing aids, and we take care of that patient. Our customer service team is highly trained to handle troubleshooting calls. So they really are very, very insightful, and they go through rigorous training on a regular basis. So I just wanted you to know that whether it is a corporate where they have to send it in for programming, we are following up. We are doing everything we can to service the hearing aids as well as the patient. Okay, I know that we are running behind on time. That's a high-level overview of our company. Is there any questions that I can answer for anyone or give clarity on?
The first question, Diane, comes from Sandra, and she said, can a customer sign a medical clearance waiver if they do not obtain or do not want to obtain medical clearance?
Yes, that's a great question. Yes, they can, as long as there are no FDA red flags. They may most certainly do that as long as we are not seeing anything of question, yes. But they are always advised that a medical exam is best.
Okay, and what, just following up on that, what do you mean by the FDA red flags? Would that be something that might indicate that they have a medical problem that they need to have checked out?
Yes. So if they have, air-bone gaps of 15 dB or greater, ear drainage, things of that nature, yeah, we will most certainly have them have what we call the medical clearance signed and on file. That is a good question.
The toll-free number that you mentioned under access and support, do you have that available?
I have that on the screen
so the
right now.
855 number is toll-free number?
Yes.
Okay.
Yes. And I encourage everyone, if you just even want more information, feel free to call in. It doesn't have to be for an appointment. We are happy to make an appointment, but it's also for information as well.
You said something that caught my ear, and that was if for some reason they're not satisfied and they the patient can send their hearing aid back. The only thing that they do not get back is the shipping cost. We get a lot of questions about that very thing in our office here, and we've heard of just outrageous restocking fees. And sometimes it's not worth for the person to return them because it just doesn't make sense. So what you're saying is that there's no restocking fee. Within those 70 days, you can send back your hearing aid if you're not happy with it, and all you do is pay shipping. Is that correct?
That is absolutely correct, yes. And shipping, I believe, is $20.
Okay, that sounds like a good deal.
Yes.
Okay, good. What can you say more about just the subject of ordering hearing aids by mail? What about fitting them so that they're comfortable and that kind of thing?
Right, I can really shed a lot of light on that since I am one of the audiologists on call, so I do talk to people all over the country. So if there is an issue, you mentioned comfort, number one, I'll address that. We talk about, is it, and let's say they have a slim tube, behind the ear hearing aid with a slim tube. So we talk about the issues of the fit, and then according to what we are hearing, then we will send out, a different set of tubes or chips, different sizes, working with them on, how to change that, and so forth and so on. We talk about proper insertion. And then also about the fit as far as programming and fit. Let's say, for example, there's a patient that says, it's just whistling all the time. Well, for me, first of all, I'm going to go to insertion. Is it properly inserted? So we start from the ground level up. And if it's something where, hey, it's a program adjustment, or it's too tinny, too sharp, too loud, again, we have our customer service team send a shipping label, and that way, again, we are passionate on that as well because that is tracked and insured. So we send it out to them either by email or by postal U.S. mail, and then they send it in to us. We make those proper adjustments, and again, an audiologist is looking at all of this, talking with the patient, and we're making those adjustments that way.
Okay. You touched a little bit about assistive devices, and I'm trying to clarify Rob's question. He asked whether there were any wireless devices, such as for TV listening, available. I know that you mentioned that most of your hearing aids include a telecoil, but what about the like Bluetooth or anything like that?
That is a great question. We get that a lot. So no, yes, there are 3 of the behind-the-ear hearing aids that have a telecoil, just one that does not. But we do not have wireless capabilities. And again, with our mission to keep costs down, providing affordability, we do not have wireless technology.
Okay. I'm just waiting to see if anybody else has questions, but in the meantime, I just want to let everybody know that HealthInnovations is a platinum sponsor of our Walk for Hearing program and also a sponsor of our convention, and we look forward to welcoming Health to our exhibit hall again in 2016 here in Washington, D.C. We're very excited about this upcoming convention, so hope everybody that's listening is planning to attend. Health has also been very generous in putting or partnering with HLAA in putting out PSAs that support prevention of hearing loss, and we are thankful for that. As a result of those PSAs, many of you may have heard Diane on the radio or on TV as well. So those are very informative, and we thank Health for their generosity in partnering with us on that. There is another question here from Rob. The price is far lower than what I pay through my healthcare provider, which is UW Health. How is this possible?
Sure, and getting back to that common question, again, we are part of the United Health Group, and we do leverage that large scale. So we buy in large bulk, if that's I'm sorry if that's not good English, but we buy in large quantities, and we leverage that large scale to then pass that savings, the incredible discount, on to the consumer, so more people can access hearing aids.
Okay. Christina says, I've had much better success with in-the-ear hearing aids, but have severe to profound hearing loss, and see from what's offered here that they wouldn't be an option for me. Will you have in-the-ear units for greater hearing loss in the future?
That's a good question. With how I answered earlier, just talking about how our industry is evolving and changing. Well, we are too. As a company, we're always evolving and changing. Currently, we don't have that right now. But it's not to say that we never would. I don't know that we will soon, but it's not to say that that can't happen. But no, we don't have it currently.
Okay, and Vicki apologizes for joining late, but she says, if the aid needs to be sent back, what do we do to hear in the meantime? How long does it take?
Well, turnaround time, I know it's never good to have the hearing aid out of your ear and not in your possession. The shipping is 2 days to the office, and then it's in-house 1 to 2 days, and then it's 2 days back. So, you can say a week. That's 6 days. And, we do not have a loaner hearing aid program at this time. So it is such that you do have to, if you have an older set of hearing aids, that are working, we recommend to use those. But we don't have a loaner program at this time.
Okay, so then what about a connection to a computer so that you can adjust it while you're hooked up to a computer? Is that a possibility in the future?
I would love that. I am hoping, but I have not heard that that's coming in the near future, but I know that that would be just absolutely fabulous and help us a lot. So that will always be on the horizon. I know it's just not immediate.
Okay, I guess that goes along the same lines as some of the hearing aids that are coming out now that are programmable via a mobile app. You see that in the future for HealthInnovations?
I have not heard that at this time, and again, I think that would really depend on the cost factor, as we really are working hard to keep costs down for the consumer.
Okay, that makes sense, and that's appreciated, I know. Okay, I don't see any other questions at this time. We will post the recording of the webinar on our website, hopefully within about a week's time. Although part of that week I'm out of the office on a site visit, so we'll get it posted as quickly as we can, along with Diane's PowerPoint. Again, thank you very much, Diane, for taking time out of your busy day to present today. And thank you, everybody, for tuning in with great questions as well. And if I don't see anything else, which I don't, just a thank you to Diane and myself and the very persistent cart provider, Cindy. Thank you again, Cindy. And thanks, Diane, so much. Take care. Bye-bye, everybody.
Thank you. Bye.